Hello and welcome to The Talk. Like I said last week, we are continuing profiling women who have conquered one disease, one infection, or another. On the program today, I have Martha Tolana, who is an HIV activist. She has lived with HIV knowingly for the past 17 years. She's well known in Zimbabwe, globally, regionally. She's done amazing work, sterling work, representing Zimbabwe as a country in terms of the interventions that we have done in the HIV and AIDS response. Martha, welcome to The Talk.
Thank you very much, Tari.
I would want you to start off by sharing with Zimbabwe, who is Martha Tolana? And here I'm looking at your HIV journey.
Okay, yeah. Martha is a woman very proud of my background in Chimanimani, born in Chimanimani. Yeah, and I grew up in the village. I went to rural schools, and yeah, my life has been very like what people used to call us SRBs, strong rural background, and I'm very proud of that background. I tested HIV positive in January 2003, although I'd suspected for 2 years before. And soon after my HIV diagnosis, I think about 2 months after my HIV diagnosis, I realized I was pregnant. At the time I got my diagnosis, I gave up on life because I remember there was no treatment. I got a CD4 count of 31. But when I realized I was pregnant and saw the fetus during a scan, that's when my resolve to live, just appeared when I saw this, because already I was I was halfway gone through the pregnancy, and I didn't know I was pregnant. Yes, almost halfway. Yeah. So it was like, to me, it was a pregnancy. Like I knew I was pregnant for about 4.5 months before giving birth.
Wow.
But it was full term. So to me that was a miracle, and it's one of her names in short.
How did you said initially you suspected you could be positive. What made you suspect? Any signs and symptoms? What was happening?
I had pneumonia in a space of 18 months. And yes, I would be treated and resolved, but then it would come back after a few weeks. And I remember even after the second time, I remember asking the doctor to test both of us for HIV.
And the doctor,
yes,
mm-hmm.
and the doctor wouldn't do it. But I suppose now I understand, because I think at the time stigma was very high. We didn't know as much as we know now. But also then the next challenge after, the only reason I went for HIV testing was that I'd got a new job, and I wanted to know before starting this job, since I had this history of pneumonia. So I wanted to know. But then when I knew I was HIV positive, then I didn't know what to do with it, because during the interview we never discussed. Yes, the job that I was going to do had to do with looking at health issues,
Mm-hmm.
but then we never talked about staff, or about if you're a staff member and you're HIV positive, then what happens.
Mm-hmm.
So I kept quiet, but then I started having challenges already. I discovered my CD4 count was very low, and that's when the information then was that if you go below 200, you have full-blown AIDS, you go home for home-based care and wait to, because then you won't recover. So when my CD4 count was 31, it was, and then I went into hospital twice, and then I just decided to hand in my resignation.
At work?
at work and thought, okay, and just said, I'm sorry I wasted your time. Let me resign while I'm still on probation. So, but then the director had a talk with me, and he was very supportive. He probed and probed until I had to tell him, no, it's because I'm HIV. Then he said, so what? And kept saying, then I said, my CD4 count is 31, so what? I said, so it's full-blown AIDS. So I'm dying. So he says, who says who? I said, that's the information that we have. But you wrote on your CV that you are Christian. And how does this relate with you? So he said, okay, now that and then I had to now also tell him that I was also pregnant. I'd only just discovered. So I didn't think anyone would believe I didn't know. So so then I said, oh, but by the way, I've also just discovered I'm pregnant, and it's already, I didn't know. And it was like, but his approach really surprised me. And I think I got all the support. And he said to me, well, now that I know, take back your letter. We will try everything to support you in every way that's possible. We know there's no treatment right now, but every way that's possible, we'll try and support you. If you still can't work when we've tried everything, then you can bring back your letter. But for the time being, we'll keep you here. And so in the end, I stayed 4 years in the same job. They gave me all the support. The workplace, I think that workplace was very important for me in terms of gaining my health. And even when I was I was under so much pressure from the medical side to terminate the pregnancy, because I was only 50 kgs that time, and CD4 count was 31, and yeah, my skin looked terrible, and yeah, it was. I was
how
very
did you
weak.
recover? Because I'm sure for a lot of people that's the major question now. When you are talking about 31 CD4 count, you are pregnant, and we know when somebody's pregnant, immune system somehow it's just
The support that I got from the workplace, and my brothers and sisters, no one ever changed the way they. No one changed the way they related to me. They were also very supportive. They gave me all the love. The workplace, I got all the love and support. And I think also because I disclosed to them. Yeah. I think disclosure was very important, even though my reason for disclosing was that I didn't want anyone whispering at my funeral, because I was convinced I was dying soon. So I was saying, I don't want you to, to whisper this. All these nephews and nieces need to know. It's not in newspapers or magazines or books. It also happens in the family, so that they, they protect themselves. So
any form of stigma.
There was lots. There was lots. There was lots of stigma. I remember I remember prayers from people who came. Maybe they didn't know, probably it was stigma, but from the church they would come for prayers. But then the language that was used was like, put yourself right with God, because now you are going. It was like, helping me on my way, on my way out. But I suppose it was from a position of not knowing. Now looking back in retrospect, but I think it was very important that family, was very supportive. The workplace was very supportive, and I think they were also. And I had friends, a number of friends who were scattered all over, somewhere in the Zimbabwe, somewhere around the world, whom I'd worked with before. And they were all supportive. And I started when I decided I needed to start on ARVs, I remember it was a big argument with the doctor, because they're saying we need to give you AZT when you are, so, for the, prevention of mother to child. But then I was saying, but you want to save my child and not save me. Who will be looking after the child? And you say there's a big problem with orphans and vulnerable children. And so in the end, yeah, friends helped me to get ARVs, which were coming from India. So I remember that for the first 12 months of my treatment was just coming from India.
Well, we'll continue with our discussion with Martha, who's sharing with us her journey of living with HIV, as well as her success story of preventing mother-to-child transmission of HIV. Join us after the break. Welcome back. We're continuing with our discussion. We have Martha Tolana, an HIV activist, a lady living with HIV for the past 17 years. Knowingly, I always want to say knowingly because that's the time that somebody would have gotten to know that they've got HIV. But what it means is HIV had been in their body for more than that particular period. Yes. So when I'm looking at you, we need to be celebrating, your journey and even just celebrating the successes. So what we would want to know is your child after giving birth. Yes, after 2 years, that's the final time that you went and you got to know that she is HIV negative. And I'm sure people would then want to know, at what period did you get to disclose to her, if you did? And how, particularly now, if I'm calculating, she's in secondary school already, how has it been for her having a mom who's living with HIV, who's actually public, because you are somebody who's well known. So even when you're going to high school, they would be knowing that, that's her mom and that mom is HIV positive. We know with young people, there's lots of stigma that happens, name calling. Any of that you experienced?
Yes, when she was in primary school, particularly the first 2 or 3 years, I think it was particularly difficult for her because at some point, I think as they were discussing in school, because then she was asking me how can I be HIV negative if you are positive, if you are HIV positive, but also going back when you asked how did the disclosure about my status. I was saying when I went and stayed in my sister's house where there were a number of relatives there. There were young children there.
Yes.
So I just made sure that it became a general topic. It's something that we can have converse about. They knew I was taking the young ones, even those who hadn't started school, had to learn to, the time that I took. We used to take the medication in the morning and in the evening. And so now it became a competition amongst them to say who will remind me about my time to take and also go to get my medication and my water and that kind of support. So then even though the only thing I just said was that I have this condition which is called HIV. I need to take ARVs and I need to take them every day for me to be well. The other questions they came, as I think as they grew with each stage, then it became age appropriate. So in a way that was easy for me in that sense. So she grew up in an environment where mom's condition was talked about in the household anyway. So it was easy for her to ask me when the discussions were in school. I think there were some things which were different from what she did, because I also used to go with her to workshops. If I was, facilitating workshops or if just attending workshops, she would be there with me. So she had this, and even when she started to read, she always had this material around her. So she asked how come she's negative? It's not possible if I gave birth to her when I was positive. And I talked to her that she did a test, but at some point, then she had to take a test. Because when I consulted with one doctor, then they said we can talk to her, and she said she wanted to have a test. So that's when the questions ended, when she saw she was, so she had 3 tests in her lifetime. So so the other things now that we need to worry about now is that at that time I thought by now we would not be worrying about HIV, but now she's an adolescent.
Exactly.
There are other issues now that you need to worry about. And the thing is, we don't know how to, we say,
Yeah.
so those issues, to say even some, and also sometimes, how adolescents are sometimes they are just angry and just won't talk to you.
Exactly.
And so you don't even know what they are thinking, what kind of info. But I always have all these materials around, so I know she reads a lot. So,
which is good.
so hopefully, sometimes we discuss, but not as much as I think we should have been. Maybe she's discussing with her peers, but she has lots of materials at her disposal.
Okay.
Yeah.
I want to focus a bit on the issue of your treatment journey.
Mm-hmm.
You know, the period that you started ARVs,
Yes.
that time there were lots of side effects that were
Yes.
associated with treatment.
Yes.
And even now, people still have those questions.
Yes.
To say ARVs, are they safe? Because I know if we hear it from a medical doctor, the professionals,
Yeah.
people are like, the doctor is just saying it.
Yes.
But it's better hearing it from somebody who's actually taking the ARVs. I want to hear the issue of side effects. Has this been addressed?
It has been addressed and is still being addressed, because I think the addressing is not conclusive. That's why we keep having new medicines coming up,
Yes.
because there's lots of research going on. So for me to say I was 50 kg, my skin looked terrible. I wish I brought my a picture I had taken then, because I needed to replace my driver's license and never could because of the way I looked. So I wish I could have brought it so that people actually see and compare how it is now, because they work, they are safe. Because coming from a position where I was 50 kgs and CD4 count was 31, I gave birth to a child who's negative, hoping she's still negative. Yeah. So if she gets positive, it wouldn't be from mother to child.
Yeah.
So we managed to prevent that. That's very
That's
effective.
success, yeah.
That's a success of the medicines, and and also the fact that I regained my strength and managed to start working from a point where I was actually resigned to say, okay, I'm just waiting to die. And we've seen a lot of side effects. Yes, I actually at some point I actually had where I couldn't even. I had to go on tiptoe because of the pain of going flat. So those medicines have been changed, but I'm still on first line.
Yeah.
I'm still on first line medication since that time. So the only thing is that they've changed to a better medicines as they come up, and we say that it continues. That continues. Any medication has side effects, and the fact that we are on this medicine for life, I think people should expect some side effects. I think the important thing is managing those side effects. It's just the same as someone with high blood pressure. Those medicines also have side effects, but they need to be communicating with the healthcare provider. Those with diabetes, they still need to continue. And if there's something that is not, they change to, to something that doesn't give them as many side effects. So I think as long as we learn to say sometimes we get these conditions which need a little help, in my case, which is ARVs.
Well, we'll continue with the discussion after this short break. Join us. Welcome back. We continue with our discussion on the talk where we are hearing Martha's journey with HIV. Just briefly, Martha, yes. I want you to share with Zimbabweans, we've heard the issue of adherence, how important it is. Yes. How important is adherence for somebody who's living with HIV?
It is important because you maintain, you keep the virus suppressed. Because if you give it a chance, then it will be more, like, what would I say, violent or
Yes.
And so you don't want that.
Yeah.
So you need for you to keep it at bay, you also need to keep your levels of the ARVs,
Because for me, ARVs now you take them once a day.
We are taking them once a day.
Are we looking at a period where we have ARVs that are taken once a week, once a month? I remember there was that discussion.
Yeah, they're still under research, so studies are ongoing. Yeah, so that to make taking them easier. Okay. Because even as I was saying, I used to take when I started. It was two pills in the morning, 3 pills in the morning, 3 pills in the evening. But now and then we got to 2 pills in the morning, 2 in the evening, then 1 in the morning, 1 in the evening, and now we are at 1, which I just take at night. And that's improvement. I think it shows how we continue to progress, because HIV is fairly new, and in terms of the medication. So, but then because the way a lot of people died, too many people died, we needed to quickly start making sure that there is some intervention. And how do you make that intervention happen? You just need to start taking something that's showing promise, but make sure that people are closely monitored. Yeah. So adherence is very important. Yeah.
Yes, we've heard about all these successes.
Yes.
What are the challenges that you do face as people living with HIV, women living with HIV in Zimbabwe?
Yeah, I think the challenges include what everyone else is facing around the economic challenges, because you need good nutrition. And we know that with our current environment, and especially living in urban areas, or even if you are in rural areas with the rainfall patterns changing, you need clean water, you need safe water to drink, to support your treatment. So that's a bit of a challenge right now.
But in terms of everything
So-
else related to HIV, is
It,
everything on course?
you
Where
pay-
if I want my ARVs, I can access
you
them. I
can
want
you can
CD4
you can
count.
access ARVs. For those on second line, we've had challenges of sometimes every year we get some stockouts, and people, sometimes there's a shortage, and especially with second line, sometimes people have got a week's supply or 2 weeks supply, because they are trying to manage so that everyone gets while they wait to get new stocks. We've also had challenges with the viral load, CD4 count. Currently, I know currently for me it has been a very difficult to. In 2017, I had to make a big tantrum to get my results when they didn't come. But in 2018, when my blood was taken for viral load, then I thought, okay, let me wait and see how. Up to now I never got the result for 2018, so I had to get another blood drawn, because it's every July that I have to have my blood drawn. So in July this year, it's supposed to take 2 weeks to get your result. Still not there. So I'm still pondering whether to make another tantrum. They are not taking CD4. That's in city council clinics. I'm not sure. But what I heard is that at the government facilities, they are taking CD4 and viral load, but at the at Harare city facilities, they are not taking CD4, because they said since they are taking viral load, it's not necessary. But for some of us, I think it was too much of a abrupt stop to stop CD4, because it's something that we, as part of our treatment, it was part of our monitoring.
So what would you say is your parting shot to Zimbabweans? I know we've a lot to discuss, but time is running out.
We need to know about our health, and we need to know about our treatment, and we need to give time. When we go to the facility, we shouldn't be in a rush. Never be in a rush, and take time to ask, to look if you've got the correct medicines, what is the expiry date of it before you leave the facility. So for me, that's a basic that I learned right from the time I started taking. So I think that's very important. Yeah.
Well, basically what I'm getting from what Martha is saying is your health is in your hands. It's up to you to ensure that it does go well. When you get your tablets, look at them. Are they the right ones? Are they not expired? Until we meet again next week, it's goodbye.